The Economic Community of West African States, ECOWAS, recently launched its regional community health policy in Cotonou, Benin. Impact ECOWAS reporters were there.
In Jogblakokwe, a town of about 10,000 inhabitants located some 30 kilometers from downtown Lomé, we meet Tobili Kojo. With his bag slung over his shoulder, this 48-year-old father has been working as a community health worker in the town for about 20 years, providing services to households.
J'ai commencé ce travail depuis 2007.
I started this work in 2007. We were trained in Chevy. We were provided with materials, thermometers, RDT, and Cordam. After that, we carry out vaccination and vaccination campaigns. We were told everything. We were motivated. We were paid 5,000 CFA per month, which is 15 per quarter, 4 times a year. We talked with the women in their homes. We were told to go house to house, talks about vaccination and community health protection, including mosquito nets and vaccinations. We do this every month. We go from house to house to talk with the women especially. Jogblakokwe currently has more than 13 neighborhoods. It's vast and it's moving towards a change.
Ça tend vers le changement de OTP là. C'est toujours Jogblakokwe.
The 13 neighborhood this worker is referring to have a population of about 10,000. Today, Kojo visited the Afanu family. The woman who greeted him was the one who welcomed him.
If I check the little girl's temperature and it's normal, that's good. If she has a fever, I will do a rapid antigen test for her. If it's positive, I will give her Cordam. If she is 1.5 or 2 years old, I will give her a blister prep or 6 tablets morning, noon and night. That's 3 days. If she is not doing well, I will refer her to health center.
We often receive visits from community health workers. They inform us and raise awareness about polio vaccination campaigns, mosquito net distribution campaigns, and other initiatives. They also talk to us about the benefits of personal and public hygiene, the importance of breastfeeding our children properly, and the importance of a balanced diet. The work of a community health worker is anything but easy. From Lomé to Cotonou, the economic capital of Benin, it's March 23, 2026. On that day, some 50 representatives from the 12 member states of the Economic Community of West African States, ECOWAS, as well as experts and technical and financial partners, were deep in thoughts. Their objective? To adopt the regional community health policy.
Il ne s'agit plus seulement de maladie, mais de tout ce.
It's no longer just about disease, but about everything that surrounds that health. So a clean environment is part of health, contributes to well-being. Therefore, the environment, a determinant of health, and employment can all be health problems. And so today the question is how to ensure that all sectors, all the multi-sectoral aspects that can impact health are taken into account in addressing health problems.
ECOWAS, following the withdrawal of 3 Sahelian countries, Burkina Faso, Mali, and Niger, comprises 12 member states and approximately 382 million inhabitants. In terms of health, the region is prone to infectious diseases and epidemics, the effects of climate change and social-economic inequalities leading to difficulties in physical and financial access to health care. Figures indicate that at least 52% of the population, particularly in rural areas, has limited access to healthcare facilities. Malaria, for example, accounts for between 38 and 41% of consultation, and respiratory infections between 17 and 25%, not to mention diarrheal diseases and non-communicable diseases, which are also on the rise. The region recorded a 31% increase in epidemic outbreaks in 2024. The regional community health policy is presented as a strategic framework aimed at bringing health services closer to the population. It emphasizes prevention, health promotion, community surveillance, and active community participation in the management of health issues, including hygiene promotion and fight against unsanitary conditions and environmental pollution.
Countries already have their community health policies, must do, but they aren't harmonized. Each country does it according to its own understanding. But today, ECOWAS through HAWO, the West African Health Organization, has offered itself a leadership role to guide countries, to give them the necessary tools so that this issue of community health become harmonized throughout the ECOWAS region. And the practices are the same whether you are in Benin, Sierra Leone, or Togo. That's essentially what it's about.
Countries in the region face similar health challenges requiring coordinated responses supported by strong political commitment. The West African Health Organization, WHO, has taken the lead in harmonizing national community health policies. These initiatives align with the guidelines adopted at the 26th Ordinary Session of the ECOWAS Assembly of Health Ministers held in Praia, Cape Verde, in May 2025. The Almaty Declaration in Kazakhstan in 1978, the ECOWAS Vision 2030, and the African Union's Agenda 2063 serve as guiding principles for West African leaders committed to achieving the Sustainable Development Goals, particularly SDG 3, which focuses on good healthcare and well-being. All are convinced that the community health is essential for human capital development and equitable access to healthcare. In this context, the Regional Community Health Policy was officially launched following the technical meeting in Cotonou.
On behalf of the President of the ECOWAS Commission, I officially launched the ECOWAS Regional Community Health Policy this Tuesday, March the 24th, 2026 in Cotonou.
Le choix de la santé communautaire comme levier stratégique.
The choice of the community health as a strategic lever for improving indicators in our sub-region is, and I repeat, part of our regional human capital development policy. Yes, significant progress has been made in the health sector. Yes, we will need to make further efforts to ensure more equitable access to quality health care services. Of course, that's the most important thing. This is a major challenge facing ECOWAS in the coming years. Our region is not isolated. It's a part of the world with many challenges. We all experienced the 2019-2020 to 2021 coronavirus pandemic, and I think we have learned all the necessary lessons after 4 or 5 years, focusing on what we missed during that period.
De ce qui nous a manqué pendant cette période.
In various countries, leaders are aware of the situation. Clearly, this is a work whose impact will be felt in the long term. As soon as we had the opportunity to participate in the development of this regional community health policy, we immediately incorporated it into our brand new strategic plan, which extends to 2030. Community health is a cornerstone for achieving universal health coverage. When promotion is done properly and when prevention is effective, there will certainly be lower costs in our hospitals, fewer costly complications, and ultimately fewer illnesses, since we will be focused on prevention.
Il y aura même moins de maladies puisque l'on aura mis l'accent sur la prévention.
For Sierra Leone, we're on track. What we think we want to do using the current policy is to ensure that going through the chain, the structures, although we have existing people acting in those capacities, we now want to redesignate them, change their job description, change their nomenclature. So the first challenge has to be with the finances, because we have not been able to identify a way of raising revenue to be able to source fund or to finance the basic community health workers.
We can't prevent illness from occurring, but we can significantly reduce very early on by implementing mechanisms. Initially, they are extremely expensive, but in the medium term, they become much less costly, as I just explained. So it's a question of resources, but that will never deter us from equipping our hospital and training high-quality human resources because illnesses will always exist. Our main priority now is to ensure that illnesses decrease and the number of people in hospital beds decreases. And we will have succeeded, as you ask, if the doctors, nurses, caregivers, all the healthcare staff in the hospital are present. And if at the end of the shift, you talk through the hospitals and find no one in the beds, then we will have truly succeeded, because we don't want people still lying in beds. Your question reminds me why ECOWAS is an economic community. Why must we take care of health? Because health is economic.
Aujourd'hui, en lançant cette politique régionale,
every village becomes a space for prevention, every family a health stakeholder, and every community member a partner in development. Ladies and gentlemen, together, let us make community health the cornerstone of universal and effective health coverage, a high-performing health system, and a more resilient, equitable, and united West Africa.
plus équitable et plus solidaire.
All things considered, it is clear that the success of the community health promotion policy would depend on many key points. Amongst them are strong political commitment, genuine community ownership, sustainable funding, the professionalization of the community health workers, and above all, their financial incentive from the state and local authorities. And let's not forget, for the region's leaders, health policy will no longer simply aim for the absence of diseases, but rather for the overall well-being of the population.